Good morning, everybody. Happy Wednesday, this rainy morning on Wednesday. We got to just do the best we can. But good morning, and my name is Dr. Tyler Hamel, Kingwood Chiropractor and Nutritionist, talking today a little bit more about sciatica. And I showed some exercises the other day about sciatica that are just home exercises you can do, stretches you can do that are geared towards alleviating the sciatic pain or irritation on the sciatic nerve. And hopefully some of you guys that are dealing with sciatica are trying those out. Sciatica can be a stubborn thing, but I always look at doing stretches and exercises like multiple times a day to try to get things to get unstuck in a way, try to help the nerve heal and repair a little bit. So that it could be anywhere from a week to a month or maybe longer sometimes. I see chronic sciatica pain. But nobody wants to go that long with the pain in the butt, obviously, because that is no fun. So the exercise is great. And I forgot to mention something else, like nutritional supplements there. And there is medicine, obviously, that people take when they have sciatica or inflammation. And I wanted to mention that today. So St. Johns Wort, that is it's been around forever, but most people probably don't know that it can definitely help with nerve pain or help alleviate nerve pain. St. Johns Wort from MediHerb that we use, you can use 2 or 3 a day. That's it. That's all you need. And any inflammation that you can get down on the sciatic nerve, it's going to help, right? That can make a noticeable difference in symptoms, meaning pain in the butt or numbness in the butt, numbness in the leg, all the way down to the foot. And wouldn't that be great, right? If you could take something natural to help that out. So also St. Johns Wort, if you did not know, it is kind of a nervous system calmer. So it helps with anxiety. It can help with sleep before bed. And also it is one of the few natural supplements that is an antiviral. And when we talk about viruses, we have viruses that are kind of enveloped and non-enveloped, as they call it. It's not really important to know that, but just in general, it's a good antiviral. So many good things about St. Johns Wort, and it's very inexpensive product as well. Just always make sure that you get the right kind, say the right brand, the right quality, because just like anything, turmeric, echinacea, St. Johns Wort, there are companies that make it that are not using the right part of, say, the root, or they're not harvesting it properly. So it says the name, but you might not get the same results. And we see that people taking our St. Johns Wort or turmeric or other supplements, they say, wow, I took this before and really didn't get the same result. So if there's one bit of information, go for quality. Do not go for the most inexpensive brand of whatever supplement you're trying to take, because most likely it's going to use the cheapest form of that or ingredients to put in there, and it might not give you the result that you're looking for. So another thing, and I apologize for not doing this in the past, but anytime I mention a supplement, I think it's always good to know, obviously the effect or the reason for taking it, but there's always a medicine on the other side of that can be prescribed. And I think it's important to know the medicine, of course, but also the potential side effects of the medicine. And in this case, we're just talking about medicine that gobbles up vitamins. That's part of the title here. So when you take medicine, it can deplete the natural vitamin stores or minerals that are in your body. And a lot of people wouldn't know that, right? And that it can be an advantage to taking something natural like St. Johns Wort, because it doesn't do that. But lots of medicines do that in your system. And most people are not getting enough vitamins and minerals, or good quality vitamins and minerals these days anyway. So when you're deficient to begin with, and then you take a medicine that makes you more deficient, that's just not good all the way around. Yes, there is a time and place for medicine. My mission to help as many people as possible get healthy naturally without the use of unnecessary medicine or surgery. Yes, there is necessary times for medicine and surgery, but there's lots of times that's not necessary, right? And there's natural things that you can do. So let's talk about anti-inflammatories first. So NSAIDs, or non-steroidal anti-inflammatory drugs, as they call them. So that could be Advil, Aleve, Motrin, Naproxen, Voltaren. There's many other different ones out there, right? And you're mostly going to take that for inflammation. So sciatica, there's inflammation. So oftentimes a doctor might recommend something stronger on the anti-inflammatory side, or the patient might just go to the pharmacy and grab something over the counter. So when you take anti-inflammatories, and just remember, anti-inflammatories initially when they recommended it, it's kind of a 4 to 6 week thing, maybe 8 week thing, but it was never meant to take every single day for the rest of your life. So what when you're taking anti-inflammatories, what vitamins in your system does it deplete? It's important to know this. So number 1, vitamin C. Number 2, folic acid. Number 3, iron. And number 4, potassium. So those are all, say, vitamins that we might not have enough of anyway, and they're just getting more depleted when we take this medicine or NSAIDs. So along the anti-inflammatory route as well, there's stronger stuff, right? So steroids, cortisone, prednisone, Medrol, Decadron. Sometimes patients come in, even with sciatica or back pain, and they've already had a pain shot or a cortisone shot. Back, hip, knee, we hear of this often. It's a massive anti-inflammatory, right? So when taking steroids, what vitamins does that deplete in the body? So vitamin C, vitamin D. We all know that most people do not have enough vitamin D. If you don't know, go get a blood test. And even living in Houston, where we have plenty of sun, there is so many people that are low in vitamin D. Vitamin D helps with a whole host of things. So it's kind of a no-brainer when you think about, should you take vitamin D? Yes, it's very inexpensive and very helpful. So the next one, folic acid is deficient. Zinc is deficient. We hear about trying to boost our immune system, right? Zinc is a key thing. So there's many people taking zinc right now just because of COVID and trying to boost their immune system. Calcium, magnesium, potassium, and selenium. So that is quite a few different vitamins and minerals that are deficient when we talk about taking cortisone. All right, number 3, so analgesics. This is more on the Tylenol side of things, so just for pain. So remember, there are, say, ibuprofen, it's inflammation. Tylenol is just for pain. So Tylenol it doesn't really have an anti-inflammatory effect. But say for folks taking Tylenol all the time, when I was younger, I didn't know better, and I used to take Tylenol, excuse me, all the time. That and ibuprofen for inflammatory things, knees and hip and back. When I played a lot of handball, I had always had a lot of inflammation, and at the time I didn't know any better. It wasn't unusual for me to take, Advil or Tylenol, like 4 pills 3 times a day, something like that. And again, I didn't know any better at the time, and I was young. And but luckily I learned soon after that. So taking too much of Tylenol, what does that deplete in your body? So we have folic acid, vitamin C, iron, and potassium. So I think it's important to know, vitamins that are being depleted when you're taking medicine. And there's many other, medicines on this sheet that we can go over. And when I talk about natural supplements to help support those conditions, I will definitely make a point to bring in that side of, like, when you're taking the medicine, how does that affect your body? How does it affect depleting other minerals and vitamins in your system, right? Most people don't know that. So if you learn that, even if you just learned that today from watching this video, like it, share it. There's going to be thousands of people in this area that have no idea that taking medicine is going to cause depletion in vitamins and minerals. And again, we don't get enough, for most people, enough vitamins and minerals. Vitamins and minerals, they definitely help us to be healthier, right? Healing and repair, sleeping, relaxing, digesting, all that kind of stuff. It really helps us out. So if we don't have enough of those, we're going to have some issues in different conditions, anything from headaches or digestive issues, chronic fatigue, sleep issues, hair falling out, thyroid issues. All of those systems in the body require adequate nutrients, vitamins, and minerals, right? We need that. So again, Dr. Tyler Hamel, if you have any questions, put it in the chat box below. If anybody's taken St. Johns Wort out there for any nerve type of conditions, like sciatica or anything else, then let me know. Let me know how it's working. Again, St. Johns Wort, through MediHerb, we carry this in our office because it seems like more and more there's a lot of people getting sciatica, coming in limping, just can't put pressure on their leg. Maybe it's from like sitting down so much, just because we do that a lot more with COVID, working at home, poor posture, and we're just sitting right on our sciatic nerve every time we sit down. So when you have sciatica, it's kind of a tough thing to not irritate it if you have to sit a lot, right? So again, Dr. Tyler Hamel, your Kingwood chiropractor and nutritionist, And if you guys want me to talk about anything in particular, also put that in the chat box below. I've been doing this for over 20 years. I've seen a lot of patients, and while I don't know everything, I've got quite a bit of experience, and I would love to help you guys any way that I can. Our office is located in Kingwood, pretty much in the middle of Kingwood on Woodland Hills, right across from Kingwood Middle. If you ever want to drop by, please do. We have plenty of supplements in stock. If you want to just drop by for an adjustment as well, we do that as well. You don't have to make an appointment. You can just walk in. So Dr. Tyler Hamel, you guys have a great Wednesday. Hang in there here in Houston. I know we're supposed to get some rain, but you guys have a blessed day, and we'll see you next time.